Joining me now is Dr. David Rose. He is the Associate Professor for Neurology at University of South Florida, as well as on a steering committee for critical care at Tampa General. Thank you so much for joining us today.
My pleasure. Thanks for having me.
So May is Stroke Month, so obviously we want to make sure that people understand what a stroke is, but also warning signs and treatment for it so that they know window-wise it's pretty tight. Strokes, we always look at these people and their face is drooping and they're drooling and they can't walk, and we watch them go down the street, we feel really bad for them. Individually, those individuals had opportunities to hopefully avoid them or at least prevent them. And so I think probably the awareness portion of strokes is basically trying to make sure people understand this is what it is and this is what happens if you get one. So let's go backwards. Let's talk about the different types of strokes that are out there and a quick treatment on each one because there's not much we can do, and then we'll go back to causes.
Absolutely, great. So stroke comes in two flavors, ischemic and hemorrhagic. Ischemic means there's a blood clot that clogs up an artery in the brain and starves some brain tissue from oxygen and nutrients that it needs. And it can result in weakness of half your body, slurred speech, the classic stroke symptoms that we all know. The other type of stroke is a hemorrhagic stroke, a bleeding complication where the artery in the brain bursts. So instead of a pipe being clogged like an ischemic stroke, you have a burst blood vessel, an artery or vein in the brain, and that can cause a similar type of symptom. A couple of years ago, the American Heart American Stroke Association invented a fun mnemonic, FAST, F-A-S-T, so that people know about the signs and symptoms of stroke. F is for facial droop, as you mentioned. If you have half of your face looking a little bit different than the other, right? A is for arm, and what we tell our patients and their caregivers is put your arms out like you're holding a pizza box. And if you notice that one of them is starting to drift down, that could be a sign of a stroke. S is for speech, so slurred speech or something called aphasia, which is difficulty understanding or expressing speech. And then T is time, which means go to the ER ASAP, because there are some treatments that we can give if someone arrives to the emergency room within 4.5 hours of the onset of the symptoms.
Sure. Now, when we separate these two out, one's a bleeding stroke, and so we have to, one, take the blood out and make it stop. The other one's a clot, which means we got to get the blood flowing. And so that's the time limit one. Obviously, both have issues. We're not going to talk about the bleeding one today because that's obviously a little different, but let's talk about the causes of where the clots come from, what kind of person would have these, and really what they should be looking for.
Great. So one of the main causes of clots in the brain is actually from the heart. So there's a condition that is known as atrial fibrillation, which is an irregular heartbeat, basically. And during the irregularity of the electricity of the heart, a clot can form inside one of the chambers and then flick off and go to the brain. Just basically, it's a plumbing problem. Clog up one of the pipes in the brain and cause a stroke that way. Now, if someone comes in within the 4.5 hour window from the onset of the symptoms and qualifies for a special medication, they can get this medication and help reverse the stroke or even prevent it from getting very big.
Sure. You said majority of people who have these types of strokes, the ischemic strokes, they don't come in time. So there's not much we can do about it. So warning signs, we have the fast component of it, but now we have to look at, since they have this window and not very many people make it inside that window, it's kind of a debilitating piece because we as doctors look at it and go, I can't do much about it. So looking at this AFib as a portion of the causes for these, the people that have AFib symptom-wise, they may not know they have AFib, and then the treatments for AFibs obviously is out there, but maybe if you don't know, you don't know.
Exactly. Only 50% of patients with AFib actually have symptoms. The other half are asymptomatic, right? So they don't even know they have it. And what you can do is go to your doctor and get an EKG on your annual physical just to make sure you don't have it. But if you do have some of the symptoms of AFib, then of course go sooner, right, to make sure that you don't have it with that EKG. And those symptoms can include palpitations, like your heart's racing away, and not when you're exercising or giving an interview like I am, but rather, you know, just sitting at home watching TV and you feel your heart racing, that could be a sign. Or if you feel like you're about to pass out or have a very continuous dizziness episode, lightheadedness, all those could be signs of a heart electricity problem. And therefore, if you do get the diagnosis, you should consider being on a strong blood thinner, right? Not just an aspirin or a Plavix, which are weak blood thinners, but a stronger one like the old-timey drug Coumadin or warfarin, which we all know about, or one of the new agents like Pradaxa that's come on the market that can thin the blood enough that you won't actually develop this clot in the heart and therefore it won't go to the brain.
So prevention's a good piece. People who have issues with their stomach, bleeding issues, things like that are excluded from that. So when we look at treatments for AFib, one is to slow the heart down, try to put it back in rhythm. Two is to obviously make the blood slippery so it doesn't get stuck in there. And then as we look at these things, we look for arteries going up that may cause turbulent flow going through too. So there's a lot that we can screen for, and there's always the carotid ultrasound guys that come by and say, hey, we can look at these things. The AFib, that little fluttering sensation, it's difficult. I mean, it really is. For most people to pick up, they say, I feel like something's wrong. That's all I can think of.
Right.
So having a good conversation with their doctor is a big deal, because that information might be something that saves you in the future.
Absolutely.
And that annual physical that we all hate also would be helpful as well. So when we look at treatments for these, you talked about a clot buster, you talked about anticoagulations. Anything else?
Well, there is a certain procedure that we can do. Let's say you arrive just past the 4.5-hour window. If you're within 6 hours, at certain centers, Tampa General where I work, actually we have this availability, and that is IA, intra-arterial treatment, clot removal. So what we actually do is call one of our surgical colleagues that goes in and does a catheterization, so not a real surgery, it's a procedure, but what they do is they snake a catheter from your artery next to your groin, up past your heart, through your neck and into your brain, actually yank out that clot from the brain. If you don't, necessarily qualify for the 4.5-hour window, but let's say you're in the 6-hour, or some people who don't get better from the clot buster before 4.5 hour, they could also qualify for this clot removal.
Sure.
And it's a very tricky procedure. It has a lot of risks, but it has a lot of benefits too. We see a lot of good outcomes. We have a couple of neurointerventionalists, is what they're called, that actually do this procedure at Tampa General. There are a few of these folks who are at other hospitals in the Tampa Bay region, but you have to be at a comprehensive stroke center. There's a lot of primary stroke centers out there that can give the medication, but don't have the facilities to take out the clot. Tampa General and some other places around the region do have those guys who are on call 24/7, because you never know when a stroke's going to strike, and they're there to help out.
Sure, and EMS, the guys that come scoop them up when they have problems, they know this list, so you don't have to worry about saying where that. They're going to take you to the closest hospital.
Exactly.
The outcomes of these things aren't always great. And we have a big window that we talked about, and then we have these poor outcomes. So prevention, obviously, is the biggest piece. When we talk about AFib, recognizing symptoms, seeing your doc, getting treatment, those are all good. Last piece that we can go in there is maybe diet, exercise, looking at those things, being in better shape, making
You
sure
know what
the
else?
treatments.
Hypertension. That's the number one problem, probably the number one cause of stroke, even more than AFib. People need to take better control of their diet, getting the salt lower if they can, or get rid of it altogether, because that can really cause high blood pressure, also known as hypertension. So you got to know your numbers, get it down to 120/80 if you can. Know your cholesterol, it's another big thing. Get your cholesterol, your LDL, bad cholesterol down, because that can also lead to clogging of the pipes, as you mentioned, the carotid arteries, which can also cause a stroke. If they become too clogged, 70, 80, 90%, that can cause a stroke. And then lastly, the most important thing that I would advocate for is to stop smoking. I mean, for goodness sakes, it's 2017. People shouldn't be smoking anymore. We know it causes strokes and heart attacks, but also cancer. Oh yeah, there's that, right? So, this is something that we all can, pitch in together and, talk to family and friends to try to quit smoking. And there's patches you can take or gum to really reduce your risk. Smoking doubles the risk versus the general population of having a stroke. And people who have a stroke who are smokers are 5 times more likely to die of their stroke than a non-smoker.
Yeah, so getting them to stop saves their life, getting them to exercise saves their life, going to a doctor saves your life, prevents all these problems. We just don't like to do that. Thanks so much for joining us today. Great information.
My
May
pleasure.
Stroke Awareness Month. It's great information. Hopefully our viewers will see it and appreciate it.
Thank you so much for having me.